Hello aspirants, welcome to GDC English classes. I hope you are waiting for these sessions since many days. The wait is over. The GDC English started their demo classes for upcoming GPAT 2026 as well as 2027. And you know that the GDC is meant for the quality and content. So that is the result. In the GPAT 2024, GDC got more than 3,000 qualifications. More than 3,000 plus students are qualified from our GPAT Discussion Center. So for that purpose only, to break the language barrier, the GDC started classes in English, especially for South India region students from Karnataka, Tamil Nadu, Andhra Pradesh, Telangana, especially on demand of classes in English, especially on demand of classes in English. So you know that. So from the 14th to 28th of this month, you will have a demo classes, and after that, from June 29, we are going to start the classes. So GDC is always the content as well as quality. So in this session, we will discuss about the pharmacology topic, especially receptor pharmacology. So myself, 𝘎𝙬𝙎𝙎𝙬𝙬, I completed my B.Pharm in the AP itself, and after that I went to NIPER library for my MS in pharmacology and toxicology. And since that I am in the teaching field as well as I am in the excellent platform, that is the number one pharma platform in India, GPAT Discussion Center, and I am the coordinator of GDC English classes. So if any small disturbance is there, so kindly excuse us. These are temporary only. So please make it your focus on our session. And only thing is that there are expiry for many things. There are expiry date for many things. Like that also, the old thing is put your ears in mode, listening anything. But nowadays, open your blood-brain barrier. Open your blood-brain barrier to make the things to enter into your brain. Because blood-brain barrier, a special barrier. Blood-brain barrier is a special barrier in the body. That blood-brain barrier only allows the lipophilic substance. Like that, if you are very passionate, very enthusiastic about your GPAT, sorry for the inconvenience. So always you have to be follow your subject also. So the blood-brain barrier. The blood-brain barrier is a only allows lipophilic substance. So like you are very passionate about your preparation, you are very enthusiastic about your preparation, definitely the things easily enter into your blood-brain barrier. So definitely they reside in your brain for one thing. Sorry for little disturbances. So here in this session we will discuss about receptor pharmacology. In this session we will discuss about receptor pharmacology. So receptor pharmacology. So mainly the receptors are like a formulas for our pharmacology, because if you have a thorough knowledge of receptor, you can easily understand what is the type of receptor. So what the drug is acting on receptor. For example, adrenaline. So adrenaline is a acts on beta receptor. When adrenaline stimulates the beta receptor, what will happen? There is a cardiac muscle contraction. So excess stimulation of beta receptor by adrenaline, excess stimulation of beta receptor by adrenaline causes cardiac muscle contraction. Excess cardiac muscle contraction leads to the hypertension. So then you can understand. So we have to block the beta receptor for treatment of hypertension. If heart function is in the low level, heart is not functioning up to the mark, heart is not functioning up to the mark, then we have to stimulate the beta receptor. So that's why receptors are like formulas for the pharmacology. They are like formulas for the pharmacology. So that's why we have to get detailed knowledge on the receptors. So according to my knowledge, receptors are nothing but again the formulas for the pharmacology. So what is simply a receptor? Receptor is a large molecule protein in nature. Receptor is a large molecule protein in nature that provides a binding site for the ligand molecule. That provides a binding site for the ligand molecule. So when this ligand molecule into the receptor, we will achieve some pharmacological action. We will achieve some pharmacological action. So this pharmacological action will decide based on the drug interaction. It may be agonist, antagonist, partial agonist, as well as a inverse agonist. Inverse agonist. So yes, as I mentioned earlier itself, so receptor is nothing but a large molecule. Receptor is nothing but a large molecule. This large molecule is a protein in nature. Protein in nature. It provides a binding site for a ligand molecule. So here it is the ligand molecule. That ligand molecule may be any neurotransmitter or hormone in the body, and this is the receptor. This is the receptor. So your main motto, your main intention is to crack the GPAT. So what generally GPAT gives to you? So GPAT gives to you definitely with GPAT. Once you go through the GPAT, because GPAT syllabus is like a syllabus of ocean. Once you go through the GPAT, definitely this GPAT make you to easily crack the drug inspector, to easily crack the pharmacist, to easily crack the NIPER as well as other pharma competitive exams. Other pharma competitive exams. And definitely you have to feel like that GPAT is a fixed deposit. So definitely this fixed deposit will give a fruitful result in upcoming years, and definitely it will make more stronger of your financial growth as well as professional growth. First you have to visualize yourself. You have to imagine yourself. So for that purpose, you have to put your hard work and smart work for the GPAT preparation in the 1 year as well as 2 years. And definitely GPAT Center is a right platform for that, because GPAT Center is providing pre-recorded classes on the total GPAT syllabus, and daily live classes will be also recorded, and practice test will be available, materials will be available, and we having everything content, especially 35-year previous question papers with explanation also. We have everything is available ready-made. But it's your intention. So you are energetic, passionate, enthusiastic, but the only thing is implementation. So if you are really ready to implement, if you are really ready to your brain barrier, definitely everything will come positive way. So believe in yourself. So believe in the GDC. So first subscribe to our GDC English classes. So like this, nearly up to June 28, we have the demo classes. From the June 29, we are starting the classes. So inform to your juniors, your classmates, as well as your seniors. and share this information to other fellow people who are looking for GPAT coaching. So regarding coming back to receptor again itself, so receptor is a large molecule protein in nature. It provides binding site for ligand molecule. Once a ligand molecule is binded, it generates its mechanism of action at the pharmacological action. So let's have some pinpoints regarding receptor. So John Newport Langley in 1878 first introduced the concept of receptor. So the concept of receptor first introduced by the John Newport Langley. So receptors are macromolecules present either on cell surface, cytoplasm, or in the nucleus, with which drug bind to produce cellular changes, but itself has no other function. So receptor is a large molecule protein in nature. It provides a binding site for ligand molecule. But receptor itself does not having any function. When a ligand molecule bind, based on that confirmation, there is a some action will be achieved. Some pharmacological action will be achieved. Okay. And what is orphan receptor? So, receptors for which endogenous mediator or ligand is not present are known as orphan receptor. So, there is a receptor is identified. For that receptor, still there is a no endogenous substance as well as ligand molecule is not identified. Ligand molecule is not identified. So, these are known as orphan receptors. So, simply the receptor is not having any specific function. After binding ligand only, it has the function. Next, silent receptor. So, what is silent receptor? So, receptor is silent receptor. Receptor at which specific drug bind down, but no pharmacological response. They are better called inert binding sites. Example, plasma proteins which have binding site for the many drugs. So silent. So the silent receptor also they are also not having any specific function. So what are the meaning of silent receptor? So the example is plasma protein. Plasma proteins like albumin, globulin, like alpha acid glycoprotein, lipoproteins. There are many plasma proteins. So this plasma proteins role is to bind with the drug and to regulate the drug distribution. They only help in the regulation of drug distribution, but they are not involving in any pharmacological action. Because of that, they are known as silent receptor. Because of that, they are known as silent receptor. And next, what is spare receptor? So spare receptors nothing but, for example, potassium sparing diuretics. What is potassium sparing diuretics? Name itself indicating they spare the potassium in the body and they they excrete sodium outside of the body. Only eliminate the sodium and spare the potassium. Like here also, what is the meaning of spare receptor? So they produce maximal response when so these receptors are produce maximal response when even less than 100% of receptors are occupied. The remaining unoccupied receptor just serving as a receptor reservoir called as spare receptor. So what is the intention here regarding the definition of spare receptor? For any drug to produce its effective function, effective action, there should be a occupation of 100%. There should be a occupation of 100% receptor. But in case of spare receptor, even occupation of 50% receptor and 40% receptors also, the action will be generated. For example, beta receptor. Beta receptor present on the heart. The beta receptors get occupied by adrenaline. So, heart myocardium having the pacemaker activity. Even occupation of 30% to 40% of beta receptor can stimulate the heart due to pacemaker activity. Remaining 60% or 50% receptors are spare receptors. That is spare receptor. So receptors mostly made up of proteins. So that is a common thing we know. Receptor nothing but large molecule protein in nature. It provides a binding site for the ligand molecule. When a ligand binds, the action will be produced. The action is dependent on type of drug like agonist, antagonist, partial agonist, as well as the inverse agonist. Next, so generally, drug form complex with receptor that is known as drug receptor complex. So based on this drug receptor complex, we will get a response, pharmacological action, intrinsic activity, efficacy. So any drug binding to the receptor, not receptor, any drug to show its action, it should have two parameters. One is affinity, one is efficacy. One is affinity as well as one is efficacy. Affinity nothing but ability of a drug molecule binding to the receptor, and after binding to the receptor, ability to produce action is known as pharmacological action, response, efficacy, intrinsic activity, activity. I hope everything is going fine. So don't forget to subscribe to our GDC English classes, because this GDC English classes can give daily demo classes, daily 7 to 9 p.m., 2 hours, 2 subjects, up to June 28th. So within these 2 weeks, you will go through the many subjects in the English language, especially you are preparing for the GPAT. You can understand how the GDC classes will be there, what is the strength of GDC faculty, and how content easily driven into your blood-brain barrier. So again, I am repeating, our blood-brain barrier allows only lipophilic molecule, and GDC always make the concepts and content in the form of lipophilic substance. They can easily enter to the blood-brain barrier, but it requires your enthusiasm, your passion, determination, and also a 1% of implementation will succeed your dreams into the reality. Okay, so generally, drug generally having drug, any drug have affinity. If you have a drug molecule bind to the receptor is affinity. Intrinsic activity nothing but efficacy. Once drug bind to the receptor, it should produce some action but response. That is efficacy, also known as intrinsic activity. So ability of a drug molecule binding to receptor affinity. Produce action is known as intrinsic activity. Intrinsic activity is also known as efficacy. Efficacy. Next. So based on the based on the affinity and efficacy, the drug molecules are generally and partial agonist. So we will discuss that in detail in upcoming. So here our main focus is on types of receptors, types of receptors. So generally the receptors are categorized into four major types. Receptors are categorized into four major types, like ion channel receptors, G protein couple receptors, enzyme linked receptors, nuclear receptors. Definitely in this video, I will give you a basic idea to you. So what is a receptor? Because we have to be clear to get thorough knowledge on the receptor. Because if you know that yes, this is alpha 1 receptor present on the blood vessel, when alpha 1 receptor is stimulated, that leads to increase in hypertension. So as an anti-hypertensive drugs, they use it to block alpha 1 receptor. So that's why if you have a clear knowledge on particular receptor, what is its function, what happened when this receptor agonized, what happened when this receptor antagonized, and you can easily remember when this where this alpha 1 receptor agonist useful, where this alpha 1 receptor antagonist will be useful. So that's why I am again mentioning that receptors are like formulas for your pharmacology. You can easily understand and remember many drugs if you know that what is the drug showing its action on particular receptor, how that drug showing its action on particular. We are coming to ion channels. So first one, ligand-gated ion channels are inotropic receptor, ion channels. Why it is regarded as like, because here the receptor is linked with here the receptor is linked with the ion channel. That's why the receptor is known as a ion channel receptor. Ion channel receptor. So here the categorization of receptors like ion channel receptor, enzymatic receptor, nuclear receptor. This categorization is simply based on to which substance the receptor is binding. So here the receptor is binding to ion channels, so ion channel receptors. So this ion channel receptors known as fast-acting receptors because these receptors showing their action within milliseconds. Under these receptors can generate muscle contractions, muscle contractions that actually occur in random seconds. Receptors are involved in generation of nerve impulse, action potential. Generation of nerve impulse and action potential takes place in the fraction of seconds. In the fraction of seconds. So that's why these receptors are fast acting receptor. And apart from that, here that this drug binds directly to the receptor located in ion channels without mediated by the G protein. Whenever drug bind to receptor, channel open and enter to the channel. Are there. The particular ion channel will be open. So the receptor ion channel or ligand-gated channel receptor involve ion. It is receptor activated conduction of ions. For example, what is the signal transaction? When a ligand binding to the ion channels happen. For example, binding of drug to this receptor channel, that may be sodium, potassium, calcium, right? And flow of ions through the channel, hyperpolarization or depolarization. For example, influx of sodium into the cell membrane. Influx of sodium into the cell, it leads to depolarization. Efflux of potassium from the cell membrane, hyperpolarization. Influx of Cl minus into the cell membrane, hyperpolarization. For example, barbiturates, benzodiazepines, they increase the influx of Cl minus into the neuron brain cells. They produce hyperpolarization, ultimately sedation. For example, like inotropic agents, well-known angiogram, they increase the influx of sodium into the heart and increase the contraction of heart, leads to cardiac muscle contraction. Leads to cardiac muscle contraction. So ultimately, there is a tissue response. Examples of what are the examples? Ion receptors, inotropic receptors, like channel receptors. Especially this ion channels are two types: ligand-gated or voltage-gated. Ligand-gated means binding of a ligand will stimulate the receptor. Voltage-gated, a voltage difference within the cell will stimulate the receptor. ion channel gated and gated. Next example is ion channel receptor. The A receptor, gamma amino butyric acid, a major inhibitory neurotransmitter in the central nervous system. So most of the drugs like benzodiazepines, barbiturates, and even general anesthetics, they act by increased inhibitory neurotransmission. Next, glutamate receptor, NMD, stimulatory. So glutamate, NMDA, full form N-methyl deaspartate. Full form is N-methyl deaspartate. Next, junction of two monomers. So that is one is NN receptor, nicotinic type and N-nicotinic muscle type. So there are nicotinic receptor, NN nicotinic muscle type on the cell. Nicotinic neuronal ganglion type. Nicotinic receptors are comes under ion channel or ligand-gated. Ion channel or ligand-gated. Next, fast-acting serotonin receptor, serotonin type 3. There are three types of. There are nearly serotonin receptor like 1, 2, 3, 4, 5, 6, 7. Among them, serotonin type 3 belong to ion channel receptor because serotonin type 3 receptor involves in conduction of sodium through its channel. Conduction of sodium through its channel. And stimulation of this serotonin type 3 receptor in the CTJ produces one thing. That's why serotonin type 3 receptor antagonist are like onda, etc., ghrelin, etc. So this is the information regarding the ion channel or ligand-gated channel receptors. Next, G protein coupled receptor. In the body, there are four types of receptors are there. Among them, 60 to 70% of receptors in the body are G protein coupled receptors. So if there is a 100% receptor, 60 to 70% of receptors under the G protein coupled receptors. So these G protein coupled receptors are also known as a heptahelical receptor because in their structure they contains a heptahelical like 1, 2, 3, 4, 5, 6, 7. So I will show the image, don't worry. So G protein coupled receptors, these are known as heptahelical receptors, and these are also known as serpentine receptor. For example, if you know Rhabolfia synonym Sarpagandha as well as Chotachan. The roots are looking like a snake shaped. So here also the receptors are also looking like a snake shaped. They are also known as serpentine. And these are the largest family of receptors. The largest family of receptors. Here the receptor is coupled with a protein known as G protein. That's why the name is named as a G protein coupled receptor. That's why they named as a G protein coupled receptors. So G proteins are membrane proteins. They have three subunits alpha, beta, gamma in heterotrimeric form. When all are joined together, G protein become inactive. So this G protein having three subunits alpha, beta as well as gamma. When these are single unit like three subunits as a single unit, that is an indication of the receptor is inactive in nature. But when these three subunits are like one is alpha and another is beta as well as gamma, two subunits. If the three as a two subunits, one is alpha subunit, another one is beta gamma subunit. This is the indication that the receptor is in active in nature. If these three subunits as a single unit, that is an indication of receptor is inactive in nature. Generally, when a ligand molecule binds to ligand nothing but a drug, it is a neurotransmitter, a hormone, whatever it may be. This inactive G protein converts to active G protein. In the active form of G protein, it is separated as a alpha subunit and another subunit as a beta as well as gamma subunit. And here G protein coupled receptors control the cell function by following pathways: adenyl cyclase pathway, phospholipase pathway, ion channel pathway. Generally, this adenyl cyclase pathway as well as phospholipase pathway are known as a signal transduction mechanism. For example, when you switch on the fan will be working. When you switch off, the fan is not working. So we know that simply, okay, I am putting off, fan is not working. We know that only. But why the fan is working? Because of something is happening within the electric board. That's why fan is not working. Further, something is happening within the electric board. So like ligand molecule bind receptor because of interaction between drug and receptor. Because of interaction between drug and receptor, some changes happening within the receptor. Because of that changes only we are getting the response. So to know about in the detail what are happening within the receptors after drug receptor interaction, they are known as signal transduction mechanism. So when drug molecule interact with receptor, some signal is passing into the receptor. Within the cell membrane, some changes are happening. Because of that changes, we are getting the response method, pharmacological action, efficacy or intrinsic activity. So to know in detail about what is happening within the cell membrane to generate action is known as signal transduction. One is adenyl cyclase mechanism, another one is phospholipase mechanism, and G proteins also activates through the ion channels also. Ion channel also. Next here, generally when a ligand molecule binds to G protein, generally when a ligand molecules binds to G protein, because of binding of ligand molecule to G protein, the G protein converts to active form. Once the G proteins converts to active form, again they produces different active G proteins. Again they produces different active G proteins. What are the different active G proteins? One is a GS, that is G alpha S. So this G alpha S leads to activation of adenyl cyclase enzyme and increase calcium channel opening. Increases calcium channel opening. And next is G alpha I, inactive G protein. Adenyl cyclase become inactivated or decreases and increasing the function of potassium channel. So opening of potassium channel. So generally potassium is a intracellular cation. Opening of potassium allow the potassium going outside. That leads to decreasing potassium concentration in the cell. And G, another active G protein, it leads to inactivate the calcium channels, decrease the calcium channel function. And G alpha Q, nothing but GQ, it leads to activation of phospholipase, ultimately increases intracellular calcium. Initially, G proteins are inactive in nature. When a ligand molecule binds, they become active. They become active. They become active. So when this happens, there is again production of different types of active G protein. The different types of active G proteins are having different action, and because of this only we are getting pharmacological action. So based on the ligand molecule, the cardiac muscle contraction may increases. Based on the ligand molecule, the cardiac muscle contraction may be decreases. Cardiac muscle contraction may be decreases. So here the example I tell you, if any drug, it may be agonist, antagonist, partial agonist, inverse agonist, first they should bind to the receptor. And based on the nature of receptor drug interaction, we will get the output. Okay. So here you can observe this is a diagram clearly explaining the structure of G proteins, how the G proteins converting to inactive form to the active form. So this G protein receptors also known as 7-transmembrane heptahelical receptor, also known as serpentine receptor, also known as metabotrophic receptor, because most of the metabolic activities in the body under the control of G protein couple receptors. Okay. So not only like this, even you are looking for other pharmacologies also and other videos also. So kindly subscribe to our GDC English classes and don't forget that we are starting our classes from the June 29th. From your junior classmates as you are preparing GPAT. And from 2014 to 20, the daily live classes will be going on our GDC classes. Our GDC classes. So if you clearly see, so there is a loop-like structures. Initially, this is the inactive G protein. Inactive G protein is indication of alpha, beta, gamma present as a single unit. When it becomes active, if you observe, beta gamma unit is separated, alpha unit is separated, alpha unit is separated. And this GDP alpha is active G protein. This GDP alpha is a active G protein. This active G protein will produce a 𝘎𝑆 that leads to increasing cyclic adenosine monophosphate. Inactive G protein decreases cyclic AMP levels and 𝘎𝛼𝑄 increases IP3 as well as DAG levels. Ultimately, you see the active G protein alpha GDP produce this further active G protein 𝘎𝛼𝑆 increases cyclic AMP, cyclic adenosine monophosphate and increases IP3 DAG, inocetal triphosphate as well as diacylglycerol. These are the secondary messengers. What is the first messenger? The first messenger is always a ligand molecule. Adrenaline binds to the beta receptor on heart. When this adrenaline interacts with the beta receptor, some changes happen within the cell membrane of cardiac muscle cell, and because of that, messengers produce secondary messenger. These secondary messengers are essential for the pharmacological action. Essential for the pharmacological action. Cyclic adenosine monophosphate, inocetal triphosphate, diacylglycerol, cyclic guanosine monophosphate. These are the some of the important secondary messengers in the body. Among this, inocetal triphosphate is hydrophilic in nature, IP3. Inocetal triphosphate is a secondary messenger that is hydrophilic in nature. Remaining cyclic adenosine monophosphate, diacylglycerol, cyclic guanosine monophosphate. These are the lipophilic secondary messengers. Lipophilic secondary messengers. Okay. Next. So as I mentioned, there are two signal transactions. So why the switch become on? I am putting the switch on position. Why the light is off when I am putting the switch on off position? Because some signals are passing in the active mode. Because of that, we are getting that. Here also, when a drug molecule interacting with the receptor, within the cell, some signals are generating. Because of that signals, we are getting the secondary messenger. The secondary messengers are essential for pharmacological action. To understand in detail, we are studying about signal transaction mechanism. One of the signal transaction mechanism in the G protein coupled receptor is adenyl cyclase cyclic AMP pathway. So activation of adenyl cyclase result in synthesis and intracellular accumulation of cyclic adenosine monophosphate. So the cyclic adenosine monophosphate acts to the cyclic AMP dependent protein kinase A that phosphorylate alter the function of many enzymes, so ion channels, so unstructured proteins. So simply, so when this adenyl cyclase, so for example, adenosine triphosphate to adenosine diphosphate, this adenosine diphosphate to adenosine monophosphate. This adenosine monophosphate gives a cyclic adenosine monophosphate in presence of help of enzyme adenyl cyclase, with help of enzyme adenyl cyclase. So increasing function of adenyl cyclase, increasing the levels of cyclic adenosine monophosphate. And for example, if cyclic AMP levels are more, if cyclic AMP function becomes excess, we have to negatively control the cyclic AMP production. For that purpose, in the body there is an enzyme, phosphodiesterase enzyme, that inactivates cyclic AMP, decreases cyclic AMP levels. So generally, increase increasing adenyl cyclase enzyme function, increasing the cyclic adenosine monophosphate. But when cyclic AMP become excess, that can be negatively controlled. A enzyme known as PDE, phosphodiesterase enzyme, decrease the production or inactivation of phosphodiesterase enzyme. Phosphodiesterase enzyme decrease the production of cyclic AMP or inactivate the cyclic AMP. Adenyl cyclase enzyme increase the synthesis, increase the production of a cyclic adenosine monophosphate. So cyclic adenosine monophosphate is one of the essential secondary messenger in the body. And here, as we mentioned, near 60 to 70% of receptors in the body G protein couple receptor. Under that, examples like adrenergic alpha beta receptor, histamine receptor, muscarinic receptors, dopamine receptor, thyroid stimulating hormone, nicotinic acid. Many number of examples they acting to the G protein couple receptor. They acting to the G protein coupled receptors. They acting to the G protein coupled receptors. So here you can see how the cyclic can be showing its action. How the cyclic can be showing its action. For example, when there is an activation of adenyl cyclase, increasing cyclic adenosine monophosphate a secondary receptor, and this leads to protein kinase inactive to become active protein kinase. That leads to phosphorylation of proteins to enzymes to ion channels, and ultimately increasing contraction conduction of cardiac muscle. So increasing number of contraction, that is inotropic action, increasing conduction velocity, that is positive dromotropic action. Positive dromotropic action. So increasing cyclic AMP on the heart, cardiac muscle contraction, number of contractions increases, number of beats increases, conduction velocity increases, ultimately cardiac output increases. That leads to supply sufficient blood to the all body parts as well as the organs. Same cyclic AMP on the smooth muscle like to GIT bronchi. Same cyclic AMP on the liver promote the glycogenolysis, convert the glycogen to glucose, and same cyclic AMP on the adipose tissues, lipolysis, breakdown of the lipids. The secondary messenger is same, cyclic adenosine monophosphate, but the tissue is changing, the action is changing, the output is changing. That is our physiology is designed like that. Our physiology is designed like that. Next, another secondary messenger pathway in the G protein couple receptor is phospholipase C IP3 DAC pathway. IP3 inositol triphosphate DAG diacylglycerol. These are the two secondary messengers in the body. So there is a cyclic adenosine monophosphate, cyclic adenosine monophosphate, IP3 inositol triphosphate, diacylglycerol. All these are secondary messengers essential for the efficacy measurement action. Among this, IP3 is a secondary messenger, polar in nature, hydrophilic in nature. Next, activation of phospholipase C causes formation of secondary messenger IP3 and DAC. So let's see this flow chart to get the clear information. So activation of phospholipase hydrolyze the membrane phospholipid peptide inositol triphosphate into IP3 inositol triphosphate DAG diacylglycerol. Ultimately, both IP3 DAG they increase the calcium levels. Anywhere calcium, contraction of smooth muscle, cardiac muscle, skeletal muscle, increases secretion from the glands, increases neuronal excitability. So influx of calcium to the any neuron increase the release of excitated neurotransmitters. That excitated neurotransmitters causes excitation of the neurons. Excitation of the neurons. So even some of the adrenergic alpha 1 receptor, histaminic H1 receptor, muscarinic M1, M3, they act through IP3 DAC pathway. So there are many sub examples of G protein couple receptor. Some of the receptors are acting through adenyl cyclase, cyclic AMP pathway, and some of the receptors showing their action through the phospholipase IP3 DAC pathway. Adenyl cyclase, cyclic AMP producing main secondary messenger as a cyclic adenosine monophosphate. IP3 DAC pathway producing main cyclic AMP, main secondary messenger as a inocetal triphosphate and disulfide. Inocetal triphosphate is a secondary messenger. This question asked many times in the formative examination. Formative examinations. Okay. Next, enzymatic receptors. Next is enzymatic receptor. So regarding the enzymatic receptor, here the receptor is coupled with enzyme. The receptor is coupled with enzyme known as enzymatic receptor, enzyme linked receptor. As the enzyme is involving here, the enzyme is involving here, the enzymes are nothing but catalyst. That's why these receptors are also known as catalytic receptors. These receptors are also known as catalytic receptors. Catalytic receptors. So here there are many enzymes are involving. Enzyme linked receptors are nothing but they mainly are full of enzymes. Among this, the main enzyme here is tyrosine kinase. That's why they are also known as receptor tyrosine kinase. Example: insulin, epidermal growth factor. Epidermal growth factor helps in the growth of insulin regulation. So, enzymatic receptor nothing but they linked enzymes. So here there are many enzymes are interacting with the receptor, but the main enzyme is tyrosine kinases. Examples like insulin, epidermal growth factor binding to these receptors, and guanyl cyclase. Guanyl cyclase presented cytosol in few cases. Next, so we already saw signal transduction in the G protein coupled receptor with help of adenylyl cyclase cyclic AMP pathway and phospholipase C IP pathway. Then how the signal transduction is take place into the enzyme linked receptor? This takes place into the enzyme linked receptor. What happens when a ligand is binding to enzyme receptor? Let's have a look. When agon is binding to this receptor, this binds to extracellular domain. Extracellular domain nothing but from the receptor inside, from the cell membrane inside, the domain projecting to the outside. So to that ligand will bind, and that leads to dimerization of the receptor at cytosol. Once a ligand molecule binds to receptor of this enzyme linked receptor, what will happen? The receptor may become 2 dimerization in the cytosol and activates a tyrosine kinase enzyme that leads to activation of a tyrosine kinase that leads to phosphorylation of tyrosine residues perform downstream signaling function perform downstream signaling function and ultimately shows a tissue response ultimately shows a tissue response ultimately shows a tissue response. Next, so here there is another type of receptor known as like there are also signal transductions are involving transmembrane JAK-STAT transmembrane JAK-STAT binding receptor. So this receptor is different from the receptor tyrosine kinase because does not having and they mainly consist of three components like receptor, JAK-Janus kinase, STAT signal transduction as well as activation. And here cytokine receptor, growth hormone receptor, factor receptors comes under this JAK-STAT signaling pathway. So like how the two signal transductions are there in the enzyme receptor and there is a JAK-STAT pathway, RAS-RAF pathway are the two signal transduction pathways and enzyme linked receptor. Examples like cytokines, growth hormone, prolactin, they acting through the JAK-STAT pathway of enzymatic receptor. Next, the pathway of receptor tyrosine kinase. The receptor tyrosine kinase. The pathway of receptor tyrosine kinase. The pathway of receptor tyrosine kinase. Here, agonist binds to extracellular domain. So dimerization of receptor at cytosol. Janus kinase JAK activate and phosphorylate residues. Janus kinase bind to free moving protein STAT and phosphorylation. Phosphorylated STAT dimerize and perform downstream signaling and ultimately tissue response. So how agonist binding to this receptor and what happening regarding the signal transaction and ultimately how the output in the form of response is producing. So that is simply about the enzyme linked receptor. Enzyme linked receptor is also known as catalytic receptor. So to this enzyme linked receptor, we have two signal transaction: RAS-RAF pathway, JAK-STAT pathway. Okay. Next, nuclear receptor. The other type of receptor in the other type of receptor is nuclear receptor. The nuclear receptor is different types. Different scenarios. So among that, nuclear receptors also known as steroid receptors because the steroids like aldosterone, testosterone, progesterone, estrogen, they bind to the receptors and acting to the nucleus, interacting with the nucleus, then as steroid receptor. And this is also known as intracellular receptors. The receptors are located within the cytosol, within the cell membrane, intracellular receptors. Nuclear receptors are, steroid receptors are intracellular receptors and also known as cytosolic receptors. Here, based on the examples, based on the substance binding to this receptor, they are categorized into cytoplasm receptor. So the receptors located in the cytoplasm as well as the receptors located in the nucleus as well as. And the receptors for glucocorticoids, so mineralocorticoid, progesterone in the cytoplasm level. And receptors for T3, T4 hormones, so estrogen, vitamin A, vitamin D, estrogen are in the nucleus level. Like here also, how the signal transaction is taking place. Regarding the signal transaction, steroid hormone enter the cells of the target hormone, bind to the specific receptor in the cytoplasm, and once the receptor drug, here the drug is steroid, that may be aldosterone, testosterone, estrogen, etc., form a complex, that is steroid receptor complex, drug receptor complex. This drug receptor complex becomes active complex. This active complex enter the nucleus because here a drug receptor complex is forming. That a drug receptor complex is interacting with the nucleus of the cell. That's why the receptors are nuclear receptor. That's why the receptor is nuclear receptors. And after entering the nucleus, binds to specific site on the DNA, within the nucleus. And on the DNA, there is a zinc finger proteins. On the DNA, there is a zinc finger proteins. And the activation of the zinc finger proteins will lead to generation of pharmacological action, and this regulate the protein synthesis and ultimately you will get the tissue response. If there is a binded ligand is aldosterone, the protein synthesis is of aldosterone. So So aldosterone, also known as mineralocorticoid, this aldosterone involves in sodium and water reabsorption. If ligand binded testosterone, testosterone synthesis will take place. If ligand binded is progesterone, progesterone synthesis will take place. Like that. So steroid enter into the cell, bind to the receptor and forms a drug receptor complex. The drug receptor complex interact with the nucleus, especially bind on the DNA with the zinc finger proteins. Activation of zinc finger proteins produce the conformational changes and produce a protein synthesis. That protein synthesis leads to the response, pharmacological action. Response to the pharmacological action. So this is how a signal transduction we can see. A signal transduction we can see in case of a nuclear receptors. We can see in case of a nuclear receptors. Okay, so this is our session on the receptors pharmacology. So as I mentioned itself, so in detail, we have many sub-examples. That many sub-examples will come under the autonomic nervous system, central nervous system, endocrine system, on go. Because we have to study number of drugs in the pharmacology. All drugs will act to by binding to the receptor. So that's why receptors are like formulas for the pharmacology. You have thorough knowledge about particular receptor, what is the receptor, what is the location, what is its function, what will happen if that receptor is agonized, what will happen if that receptor is antagonized. And based on that, you can remember clinical application. For example, blocking of M3 receptors in the lungs as an anti-asthmatic drug, agonism of beta 2 receptors in the lungs, anti-asthmatic drugs. So both having anti-asthmatic application, but beta 2 receptor is agonized and M3 receptor is so like that purpose we have to know thorough knowledge about the receptors. So receptors are like formulas or pharmacology because every drug is acting by binding to receptor. And like also, so again I to you, so GPAT is like a fixed deposit for your upcoming financial as well as professional goals. Definitely, this GPAT makes you to easily crack the NIPER drug inspector pharmacist, and definitely it will make you how to success in life also. And definitely you can achieve this through a number one pharma platform that is GPAT Distance Center. And for you people only, especially we launches GDC English classes to make the content more easy. Thank you. I hope the session is helpful to you. Subscribe to GDC English classes and we will connect in the upcoming session. So from June 14 to 28 we have demo classes. From the June 29 we will start the classes. Subscribe to our English channel GDC. Thank you.